Hi everyone. Welcome to the seminar Let's Talk About Sexual Health, organized by the University of Nicosia Student Affairs Office, the AIDS Solidarity Movement Cyprus, and the Cyprus Checkpoint. My name is Christos Krasidis, and I am the community health worker at the Cyprus Checkpoint and trainer of the AIDS Solidarity Movement. I'm also the chair of the Steering Committee of AIDS Action Europe and a community expert at the ECDC STI Network Coordination Committee. The AIDS Solidarity Movement was established in Cyprus in 1989, 3 years after the first diagnosis of HIV in Cyprus. The AIDS Solidarity Movement is a non-for-profit organization, a non-governmental organization, and we're a group of people advocating for the rights of people living with HIV and working around combination prevention. We have been disseminating more than 10,000 condoms and lubricants, along with informative flyers around Cyprus per year. In 2015, we established the Cyprus Checkpoint, which is the information, prevention and testing center of the AIDS Solidarity Movement. We have been providing pop-up testing for HIV and syphilis around Cyprus at different locations. One of these locations is going to be at the premises of the University of Nicosia next week, on the 23rd of February from 10 o'clock in the morning until 2. The testing is rapid, is anonymous and it's free. We'll talk about the testing in a while. The Cyprus Checkpoint has been referenced under best practices in the European HIV Testing Week website in 2016, in the European AIDS Treatment Group in 2017, and it was also referenced in the 2018 report by the World Health Organization. Since 2015, we have been involved in various researches, such as the knowledge and attitude of people living in Cyprus around HIV and AIDS, as well as the social and psychological needs of people living with HIV who are aged 50 and above. Also, we were the Cyprus partner for the STCOM project, which included 2 surveys, the European Men Who Have Sex with Men Internet Survey, EMIS 2017, and ECHOS 2017, which was a survey for community health workers, and also the training program that provided training to community health workers that were working with MSM populations. In 2018, we also implemented the PrEP in Cyprus research, and in 2019, we implemented the chemsex research in Cyprus. Last year, we concluded the research psychological and social needs of people living with HIV and/or AIDS patients, which we did together with the University of Nicosia. And now we're running another survey together with the University of Nicosia around the ramifications of the COVID-19 pandemic on the LGBTQI community in Cyprus. This survey is still running today and will be concluded at the end of March. Now let's talk about sexual health, and let's talk about sex and safety. Everyone experiences pleasure differently, but in reality, no matter how we choose to enjoy sex, we all come down to the same principle, and that is consent.
How do you know for sure if someone wants to have sex with you? Well, actually, there's only one way. They need to tell you. You need to have consent. But what does consent really mean? Consent means both parties are really, truly into what's going on. This means that nobody's being guilted or pressured into doing anything. Silence does not equal consent. Some people think it's not rape unless there's fighting, screaming, or someone yelling no. But that's not true. Communication doesn't always happen with words. Body language can say a lot if you pay attention. Are they leaning in or are they pulling away? Do they look happy or do they look uncomfortable? Are they kissing you back or are they just staying kind of still? You have to pay attention to all the signals. This includes body language and words. No one can read minds, so it's always good to talk about it. Asking for consent doesn't have to be awkward. Asking for consent can actually be kind of sexy.
Want to show me your bedroom?
Show me where you want me to touch you.
Do you want to help me take these clothes off?
So, let's break this consent thing way down. 1, everyone's clear about what's about to happen next, and they're happy about it. If you're making out with someone for the first time and you want to go further, check in first.
Gonna take your shirt off.
Wanna try something different?
2, everyone in the situation has to feel free to be able to say no without being pressured or hassled. It's not cool to pressure people into doing stuff they're obviously uncomfortable with, or make them feel bad for saying no or wanting to stop things. Being pushy or manipulative makes for some pretty bad sex. And obviously, if a person is drunk, high, passed out, or asleep, it's not okay to do sexual stuff with them. They can't consent when wasted or unconscious. So doing this is actually rape. 3, be honest about whether or not you're on birth control, have an STD, or having sex with other people. Wouldn't you want to know that? If you're going to get naked with someone, you have to have trust and honesty. 4, saying yes to sex once doesn't mean you're saying yes to it forever. It may be tough to pause in the middle of some super sweet action, but your partner has the right to stop at any time. And 5, sex is all about connections and pleasure, right? If everyone feels respected, sex will be much better for both of you. We all deserve a safe, pleasurable, and awesome sex life. The more respect you show to the other person, the more they'll trust you enough to relax and enjoy. And the more honest you are about what you want and don't want, the better things will go. It's easy to talk about what consent means, but what does it look like in real life? How are we supposed to know for sure how far someone wants to go or if they want to get intimate at all? Check out our other videos for tips on how to do this consent thing right.
When we're talking about sexual health, in reality, we're talking about safer sex. So we need to have some information around HIV and sexual transmitted infections. STIs, sexual transmitted infections, are different bacteria and viruses that are usually transmitted sexually. For instance, chlamydia, gonorrhea, and syphilis are bacteria. They usually prefer wet and warm places on the human body. At the same time, viruses like the HPV, herpes, HIV, hepatitis A, B, and C are viruses that are also transmitted sexually. In most of the cases, these STIs appear to have symptoms on the body, but sometimes some STIs appear to be asymptomatic. That means they don't have symptoms, or it takes a while until the symptoms come up. So the only way to know is to get tested. Let's focus on HIV. A lot of people don't know the difference between HIV and AIDS. HIV is the virus responsible for the HIV infection in the body. The virus destroys CD4 cells in the process of replicating itself. The CD4 cells are a big part of the human immune system. HIV uses them to copy itself, and through this process it destroys them. Without the immune system, we humans are unable to fight infections, bacteria, and viruses. AIDS is the last stage of the HIV infection. As HIV copies itself and increases its presence in the human body, CD4 cells are destroyed through this process. Antiretroviral treatment can suppress HIV so that the HIV infection does not reach to the last stage, which is AIDS. Without antiretroviral treatment, the HIV infection will reach AIDS. This slide shows the progression of the HIV infection in the human body. The red line represents the virus. While HIV is using CD4 cells to copy itself and replicate itself, CD4 cells are destroyed gradually in time. This is a process that can take a few years. Without the antiretroviral treatment, the person will reach the last stage, which we call AIDS. In the last stage, there is no immune system left. The CD4 cells have been destroyed by the virus, leaving the body without any defense. Now, if someone is diagnosed with HIV, then they start their antiretroviral treatment, which really suppresses the virus and doesn't allow it to destroy the CD4 cells. The earlier someone gets diagnosed, the better. because they can start the antiretroviral treatment earlier, and this will not allow the virus to destroy the CD4 cells. If you have a late diagnosis, then things might be a bit more serious. For HIV to be transmitted, it needs to find a way to get in the bloodstream, but it also needs to be in high quantities that should be big enough for the transmission to take place. HIV is being transmitted in different ways. For example, sexual intercourse without the use of condoms. It could be oral sex, vaginal sex, or anal sex. It can also be transmitted through sharing non-sterilized needles. Also blood transfusion, vertical transmission, and breastfeeding. HIV cannot be transmitted through kissing, hugging, handshake. It can't be transmitted through bites of insects, like mosquitoes, for example. It cannot be transmitted through the common use of toilets, showers, or swimming pools. Also, the common use of plates, spoons, forks, and knives is not a way to transmit HIV. HIV cannot be transmitted through living together with someone who is living with HIV, or sharing a flat or a house, or working together, or using the same gym. HIV is not transmitted with saliva, tears, sweat, excrement, or urine. In order to eliminate the possibility of HIV transmission, we have been advising people living with HIV who are giving birth to healthy babies to avoid breastfeeding them. When it comes to vertical transmission, pregnancy, labor, and delivery, there are medical protocols in place to allow people living with HIV on antiretroviral treatment to have negative babies. In Cyprus, we have more than 60 negative babies delivered by people living with HIV. So people living with HIV can actually have babies that are negative to HIV. We also eliminate HIV transmission through blood transfusion by checking the blood before using it. In a number of countries, there are programs that provide clean and sterilized needles for people who use substances. And we are left with sexual intercourse, and that's why we need to talk about sex a bit more. When we're talking about sexual health, we really need to talk about safer sex. There are a few tools that we can use as prevention methods: condoms, gloves, and lubricants, PrEP, pre-exposure prophylaxis, and PEP, post-exposure prophylaxis, testing as prevention, and TASP, treatment as prevention. All these tools are known as combination prevention. So let's talk about condoms and lubes. Condoms are the cheapest way to prevent HIV and STI transmission. When we're using a condom, it's important to hold the upper part of the condom before folding it down so that air is not trapped in it. If air is trapped in a condom, could be the reason why the condom could break during the sexual intercourse. It's also important to use water-based or silicone-based lubricants during anal sex. PEP and PrEP are strategies that are using pills. PrEP stands for pre-exposure prophylaxis. It is a strategy using antiretroviral treatment, pills that is, that are used around 2 hours before sex. And it is important to continue using PrEP for a number of days after the sexual intercourse. PEP, on the other hand, stands for post-exposure prophylaxis. This is antiretroviral treatment used as an emergency after sex. It only works if you take it within the first 72 hours after the sexual intercourse. More specifically, PrEP is antiretroviral treatment that is used by HIV-negative people. It is 99% effective when used properly. There are various ways to use it. It is not officially accessible in Cyprus yet, but it is accessible through the internet. You need to pay attention that PrEP is prevention only for HIV, and PrEP does not protect you from any other sexual transmitted infection. If someone else is using PrEP, a sexual partner for example, it does not mean you are protected, because you really don't know how they are using it or if they're using it correctly. Post-exposure prophylaxis is also antiretroviral treatment taken after the sexual intercourse. It is more of an emergency measure. It is 98.9% effective if you use it within the 72 hours from the sexual intercourse, but it will not work after that. The earlier you start PEP, the better it works. It is provided for free at Larnaca Public Hospital only with a doctor's approval and prescription. It is usually treatment for 4 weeks. It is important to note that if you need PEP more than once a year, then maybe you should be considering PrEP instead. Let's talk about testing as prevention. The tests we're using at the Cyprus checkpoint are antibody tests for HIV and syphilis. We provide free, rapid and anonymous testing every Tuesday from 5 to 8 p.m. at the center of Nicosia in our premises. You will need to book an appointment either by calling 9960 7005 or through our social media. There are no waiting periods. You get the result immediately while you're taking the test within the 10 to 15 minutes of a session. The testing window period is 3 months. This means that if you get tested today, the test will not detect the antibodies of the last 3 months, which means the last 3 months are not covered by the test. The Cyprus checkpoint is located in the heart of the old city of Nicosia, in a walking distance from Solomou Square, where the buses are. It's pretty easy to find it. You can use your Google Maps to guide you through. Remember that we're having a pop-up test day on the 23rd of February, which is next Wednesday from 10 o'clock in the morning until 2. So feel free to drop in the first aid room at Europa Building Level 1. If you need any guidance to find the room, please contact the Student Affairs Office. Remember, the test is rapid, is anonymous, and it's free. The last part of combination prevention is what we call TASP. TASP stands for Treatment as Prevention. This means that people living with HIV under effective treatment have an undetectable viral load. An undetectable viral load means that the virus in their body is less than 200 copies per 1 ml of blood. When someone is undetectable, is also untransmittable, which means that there is effectively no risk of HIV transmission when having oral sex, anal sex, or vaginal sex, even without the use of condoms. This refers only to HIV. But how do we know that? There were a number of different researchers in the past, but the latest one was in 2010, which lasted until May 2014, and it was called the Partner Research. The research was looking into HIV transmission when viral load is undetectable because of effective antiretroviral treatment. In this survey, we had almost 900 gay and straight couples where one partner was negative and the other was HIV positive with an undetectable viral load. The couples were already having condomless sex and they had an average age of 40 years old. The research examined 58,000 sexual intercourses. The result was zero HIV transmission from the HIV positive partner to the HIV negative partner. This was announced in July 2016. Then we had the second part of the survey, called Partner 2, which continued the survey only for couples of gay men where one was HIV positive and undetectable and the other was HIV negative. 782 couples took part in the survey. A total of 77,000 sexual intercourses were examined in this research. And again, the result was zero HIV transmission from the positive partner to the negative partner. The results were published in Lancet on the 2nd of May 2019 and were presented at the AIDS conference of 2018. Alison Rogers said in that conference, "The risk is zero. The time for excuses is over." So this means that we need to be a bit more specific when it comes to HIV transmission routes, as sexual intercourse without the use of condom only applies when the viral load is detectable. We also need to update the list of the no HIV transmission routes and include that HIV cannot be transmitted when the viral load is undetectable. This completes the combination prevention tools that are available to us. Well, apart from PrEP, which is not really yet. accessible in Cyprus through the official health system. If you have any more questions or need clarifications, please don't hesitate to contact us through our social media pages. You can find us on Facebook, Twitter, Instagram, YouTube, and even on Grindr, Scruff, and Romeo. You can also attend the testing day on the 23rd of February and ask any questions you have there. Remember that we should take care of each other and create a safe space for ourselves and our sexual partners. Take care. See you soon.
And I can't change, even if I tried, even if I wanted to. And I can't change, even if I tried, even if I wanted to. My love, my love, my love, she keeps me warm. She keeps me warm. She keeps me warm. She keeps me warm. And I can't change, even if I tried, even if I wanted to. My love, my love, my love, she keeps me warm. She keeps me warm. She keeps me warm. She keeps me warm. And I can't change, even if I tried, even if I wanted to. My love, my love, my love, she keeps me warm. 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 She keeps me warm.
My heart doesn't see race.
Love has no age limit.
That's my best friend.
We are neighbors and best friends.
We all have different religions, but we have universal love as well.
I love my sister.
Love is love.
Our family is no less than any other family.